Good evening, everyone. The rift is growing tonight between a president who holds that there are no limits to his power and governors on the East and West coasts who have formed alliances to set their own criteria for rebooting the economy. But that kind of talk was briefly drowned out here in New York late today when officials acknowledged what was widely feared, that the number of dead is far higher than reported. Tonight, more than 3,700 additional names being added to the state's already staggering death toll that now tops 10,000. Our team is in place. Let's begin with the latest on the pandemic and Gabe Gutierrez in New York.
At the nation's epicenter, a stunning spike. Late today, New York City abruptly increased its death toll by 3,700. City officials say the total is now more than 10,000 because they're now including people who'd never tested positive for COVID-19, but were presumed to have died from it. The virus is increasingly targeting the most vulnerable.
The percentage of loss of life is getting higher in the nursing homes.
Around the country, deaths at long-term care facilities are mounting. NBC News counts 4,300 across 27 states, almost double last week's number. There are heartbreaking reports in Massachusetts, Virginia, and New Jersey, leaving loved ones in limbo.
There's got to be more personal contact. These people are dying, and they're getting a letter. It's really sad.
And new hotspots are emerging from Indiana.
These people might walk in through the emergency department, and within an hour, they're on life support.
To Missouri.
I've been a nurse for 11 years, and I have to say this is something that I've never seen before.
To South Dakota, where the governor is resisting a stay-at-home order, despite one of the nation's largest pork processing plants shutting down after more than 400 workers got sick.
This plant would have been up and running because it is exempted as an essential business that is a part of our critical infrastructure plan.
In New York, the curve is flattening, but despite assurances that there's enough protective gear for medical workers, New York City officials are now asking sports teams for rain ponchos to use as makeshift surgical gowns for a health system still under incredible stress.
In the past 2 weeks, I've probably seen as much death as I've seen in the past 3 years. It's bad. It's really sad.
Dr. Angelo Messia is a third-year ER resident at St. Barnabas Hospital in the Bronx, where these refrigerated trailers act as temporary morgues.
I feel like at this point, everybody we intubate is just, it's terminal. Like, it almost feels futile.
Among the lives lost, Bernie Rubin, the co-founder of an iconic New England furniture store chain. Abdul Ahad Wahab and his wife Tazroon both died from the virus outside Houston. They've been married 53 years.
It was just so fast. I dropped my parents off at the ER, my dad on Friday and my mom on Saturday. And they were not even a week in the hospital. They passed away.
The CDC says more than 9,000 healthcare workers have reported testing positive for COVID-19, likely an underestimation. Lester?
All right, Gabe Gutierrez, thank you. Now to the enormous challenge of reopening the country. Tonight, California's governor is laying out goals and the new normal ahead in what could be a model for other states, as President Trump claims that he has the power to make those decisions. Here's Tom Costello.
With California announcing a record 71 deaths in one day, the governor today said it will take time to ease these stay-at-home restrictions.
This phase is one where science, where public health, not politics, must be the guide.
Governor Newsom announcing 6 steps in what could be a blueprint for the nation, including community testing and isolating those who are positive or exposed, preventing infection in those who are at risk, preparing hospitals to handle a surge of patients, therapeutic drugs to meet demand, and social distancing at schools and businesses.
You may be having dinner with a waiter wearing gloves, maybe a face mask, dinner where your temperature is checked before you walk in to the establishment.
Newsom among the governors asserting their own independence after President Trump said he alone had total authority.
The President of the United States has the authority to do what the President has the authority to do, which is very powerful. The President of the United States calls the shots.
The president insisting he, not the governors, will decide when to reopen states.
When somebody's the President of the United States, the authority is total. And that's the way it's got to be.
Those comments touching off dissent.
His proclamation is that he would be king. That's what a king is. A king has total authority.
And disagreement, including from some Republicans.
Governors made decisions to take various actions in their states based on what they thought was right for their state.
Several regional state governors quickly announced they would coordinate with each other. In the Northeast, New York and 6 other states say the goal is to ease social isolation without triggering renewed spread. In the West, Washington, Oregon, and California have announced their own council. Even conservative constitutional law scholars say the president is simply wrong.
I have no idea what he is talking about. No clue. The Constitution does not give the president the power to instruct states what to do, and Congress has not given the president the power to instruct states what to do. The president simply lacks the authority here.
By midday, the president and several governors were talking about cooperation and reopening the economy.
I'm going to be making a decision pretty quickly, and it's being done in conjunction with governors.
I put my hand out in total partnership and cooperation with the president.
Late today, President Trump announced that he is suspending all funding for the World Health Organization pending an investigation. The president accuses the WHO of mismanaging the pandemic and covering up the crisis. Lester?
All right, Tom Costello tonight, thanks. The other huge factor in reopening the country, as we have been reporting, is the critical need for much broader testing. After our inside look last night on antibody tests, tonight a closer look at the other kind of testing and contact tracing that are also essential. And what's the holdup? We get more from Stephanie Gosk.
Some health experts say we need millions of tests a week. Some say millions a day before enough data is collected to begin letting people back out. But as some lines for drive-through testing just get longer, there is agreement on one thing. The country is not testing nearly enough.
We have to develop that widespread testing capacity.
According to the COVID Tracking Project, roughly 150,000 people are tested every day.
Widespread diagnostics are the key. So let's keep pushing that forward to the point where anyone who needs to get a test in the country can get it that same day.
So what is standing in the way? Supply shortages, including the testing kits and nasal swabs. Infrastructure shortages, not enough machines and labs to run the tests. And there aren't enough people, from those who administer the tests to those who process them. Right now, there are an untold number of Americans suffering from COVID-like symptoms who simply can't get tested. Sometimes it takes money. Cersei Farrell struggled for days to get a test. In the end, a relative loaned her $225 to go to a private clinic.
As soon as the doctor called and said, hey, I have a patient, she's got all the symptoms, we need to get her tested, I should have been tested.
Widespread testing is just part of the equation. Getting a handle on transmission requires knowing who has it and who they exposed. Those at risk, including anyone who came within roughly 6 feet of someone with COVID-19, would have to self-isolate for 14 days. Massachusetts is hiring 1,000 contact tracers as part of a new program.
What we want to do on the offensive is find. Even if people aren't very sick, find them so that they don't infect their family members or their other close contacts.
But health departments don't have the staff needed to handle programs on this scale.
We need something on the order of 100,000 people working on this effort in the coming year.
Apple and Google announced new technology that could help. Phones ping other phones around them with their location. People who contract the virus report their diagnosis to the app, and anyone who came close to them is notified. But that raises another concern: privacy. And finally, the problem of enforcement.
Is there a sense that people have enough social responsibility to self-isolate without being compelled to self-isolate?
We believe that that is the case in this country, that most people, the vast majority of people, would willingly isolate themselves.
All of this while the world awaits a vaccine and faces the reality that even with one, our lives will never be the same. Stephanie Gosk, NBC News, New York.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.